Hello and welcome to the Pediatric Dental Clinic at the University of Illinois at Chicago College of Dentistry. This short film will review what early childhood caries is, what causes it, how it can be prevented, and what infant oral assessment is and why it is important to bring your child to the dentist early. Chapter 1: Early Childhood Caries. Many years ago, dentists used to diagnose children with baby bottle decay syndrome, a disease marked by significant dental decay thought to be caused by infants being put to bed with bottles. As research into the basis of this disease increased, it was found that the bottle was not the only cause. As a result, a new name was given: early childhood caries. Caries is the term that dentists use to describe what is more widely understood as dental decay or cavities. The Centers for Disease Control and Prevention reports that while dental disease is on the decline among the general population, it is on the rise in children between the ages of 2 and 5. Early childhood caries can have alarming and serious consequences that include lack of proper physical development, decreased ability to learn, and frequent hospitalization and emergency room visits. In February 2007, DeMonte Driver, an 11-year-old boy from Maryland, died of a tooth infection. Preventing dental caries is something that adolescents and adults do on a daily basis. Preventing dental disease among infants and toddlers, however, is a fairly new concept. In the past, children were being seen for their first dental visit at age 3. Now, in order to prevent dental caries early, children should be seen at age 1. The earlier you can interrupt the path from a healthy tooth to one with cavities, the better. To prevent dental caries, it is critical that children are seen within 6 months after their first tooth appears and absolutely no later than age 1. It is important to establish a dental home for your children early so they have continuously accessible, comprehensive treatment from their dentist. Chapter 2: What causes cavities? Caries begin as white lines or spots near the gum line, and within months can progress very quickly into an actual cavity. The risk of getting a cavity begins as soon as the first tooth appears in the mouth. Bacteria that grow naturally in your mouth eat the sugar found in the food you eat. As the bacteria digest these sugars, they produce acid that wears away on the outer layers of your teeth, causing cavities. Infants can get these bacteria from many sources. However, the most common source is from their parents. For many parents, it seems perfectly normal to lick a pacifier clean after it falls on the floor, or to taste baby food before feeding their child. Simple things like this transfer bacteria from one mouth to another. It is important for parents to be aware of these instances and avoid them whenever possible. Expectant mothers are encouraged to go to the dentist to get their dental needs taken care of in order to have optimal oral health and reduce the germs they pass to their children. Early childhood caries is associated with drinking sugary beverages frequently or for long periods of time. The risk of getting cavities is decreased by appropriate feeding patterns and a few preventive measures. One of the most important preventive measures is to not put infants to bed with a bottle containing sugary liquids like milk, juice, or soda after the appearance of the first baby tooth. If a child falls asleep while bottle feeding, the teeth should be cleaned with a moist square of gauze before placing the child in bed. Children should be encouraged to drink from an open cup as they approach their first birthday and be weaned from the bottle by 14 months of age. Sugary drinks in bottles and non-spill cups should always be avoided. Snacks should be limited to less than 3 times a day and not for more than 20 minutes. Try to avoid sticky, sugary snacks. Frequent snacking can increase the risk of getting cavities. Chapter 3: How to prevent cavities. Caries, or dental decay, is the most common infectious disease among children in the United States. Every year, thousands of kids suffer from early childhood caries. The good news is that parents can easily help prevent early childhood caries if they follow proper diet and oral hygiene. Your child's teeth start coming in at 4 to 8 months of age. Early childhood caries can start as soon as the first tooth comes into the mouth. Although the child will lose his or her baby teeth eventually, they are extremely important. They help your child eat, speak, and function normally. You should start brushing your child's teeth as soon as the first tooth comes into the mouth. Additionally, a dental home should be established within 6 months of eruption of the first tooth and no later than 12 months of age to develop a preventive program for the individual child to decrease the risk factors of the disease and to increase the protective factors such as proper oral hygiene, proper diet, and appropriate use of fluoride. Exposure to fluoride in the proper amount to the child is important for good oral health. Fluoride has been shown to prevent caries by strengthening the enamel, the outer layer of the tooth. You will need to brush your child's teeth twice a day with fluoridated toothpaste. A pea-sized amount of toothpaste should be used for children ages 2 to 5 years, and a smear of toothpaste should be used for children younger than 2. Parents of young children should always supervise them as they brush. Using dental floss when teeth begin to touch one another is also important in reducing cavities between the teeth. After the dentist assesses the fluoride intake of your child, the dentist can prescribe fluoride supplements if your child is not receiving enough fluoride from water, formula, or other beverages. Chapter 4: Infant Oral Exam. Before examining your child, the dentist will review your child's medical history with you and ask you some questions regarding diet, oral hygiene, and other habits such as pacifier and finger sucking. After recording all of this information, the dentist will complete the oral exam. To properly examine infants, your dentist will likely use a method called knee-to-knee. In this situation, you and the dentist sit across from each other so that your knees touch. The child's head is placed on the dentist's lap with the child's legs resting on the parent. It's okay if the child begins to cry. The open mouth gives good access for visual examination. It is important for the parent to hold the child's hands so the child doesn't grab the dentist during the examination. During the examination, the dentist will evaluate the soft tissue, including the gums, tongue, lips, and cheek for any sign of disease. The dentist will also evaluate the teeth for any white spots, cavities, and to see if the teeth are coming in normally and in the correct order. Next, the dentist will brush your child's teeth using a toothbrush and fluoridated toothpaste, demonstrating to you the appropriate way of brushing your child's teeth. Finally, the dentist will apply fluoride varnish that helps in strengthening your child's teeth. If your child has cavities that need treatment, the dentist or front desk clerk will schedule these appointments for your child. If your child does not have any cavities, your child will be scheduled for his or her routine 6-month checkup. Based on the information collected and the results of the exam, your child may be classified as having a high risk of getting cavities. In this case, the dentist may recommend a checkup every 3 to 4 months. After the examination and cleaning is completed, the dentist will discuss with you the findings and any recommendations on maintaining or improving your child's oral health, as well as topics you need to be aware of before the child's next visit to their dental home. Thank you for viewing this film. We hope you have learned more about the importance of taking care of your children's teeth, and you will continue to bring your child to their new dental home.